Hi, I'm Heather Wallace from the Central Nursing Education Department, and I'm here to talk to you about nurse residents. Some of you may have been to preceptor class. Some of you, this may be a crash course for you, and that's fine. We would like for you to go through the full course, but we're going to get you what you need so that you can start with your nurse residents. Precepting a nurse resident is different than an experienced nurse. So they're not coming in with this base of knowledge and you're just showing them where the bathroom is. These guys are excited, they're eager to learn, they're incredibly nervous, but you've got to remember they don't know things intuitively the way you do. So you've got to take a little bit more time, and it's going to take a little bit longer with these guys. Following this presentation, you're going to be able to apply the theories that you learned in preceptor class if you've already taken it. Integrate your personal skill set. So you were chosen to be a preceptor for a resident because of your clinical knowledge. And now you're having to impart that knowledge to somebody else, which means you have to explain yourself often and repeatedly. Formulate an individual orientation plan because not every resident is created equal. Some of them may have been an LVN, may have been a PCA, and some of them, this may be their first adult job ever. So they went straight through school. Then how to use your communication skills so that you can provide them feedback, because they need lots and lots of feedback from you, both positive and constructive of the things that they need to improve on. They need to hear these things, otherwise they're not going to change and get better. Remember, you're grooming a coworker that you're going to depend on. And then the last thing, how to validate their competencies. So you are using your professional signature to say that they are a safe practitioner. And what does that look like? So the first year of a new grad's life is called their transition to practice phase. So it takes up to a full year, sometimes 2 years, for them to really get to that competent level. That's why they say, for instance, certification, that you should have 2 years experience prior to getting certified in a specialty, because you're really not a content expert and very knowledgeable about that realm of nursing. So a nurse residency program is there to help transition them through that first year. And so the first piece of that is a preceptorship with you on the unit. And then their success is largely dependent on the coaching that they receive from you, how you socialize them to the unit, how you welcome them into the fold, validate their skills, show them how to communicate with the greater team. So one of the things that you learned in preceptor class was what competency meant. So it's the knowledge, and some of that they're coming with. So they have the basic knowledge, they've passed NCLEX, but they may not have the critical thinking and the application of it, how to make those decisions. Then there's the skill. So they have some basic skills, usually in simulation lab. They may have done one IV start on a live patient. And then the attitude. So they're coming eager to learn. So that part we have going for us as opposed to an experienced nurse. So you need to continue to foster that. Remember, you are growing a coworker. So just another quick review. In the preceptor class, you learned about the novice to expert continuum. So they're coming in as a novice. They have little to no professional experience. They only have what they were exposed to in clinicals. And then you're trying to get them to that first step, that beginner, advanced beginner, so that they're safe practitioners, that they can take care of a patient load by themselves, and they know their resources if they get stuck. So in that beginner phase, that novice phase, they're coming to you and they're very task focused. They'll actually still be pretty task focused when they get off of orientation. But they're coming to you with the general rules that they learned in school. They're very black and white. They may ask things like, that's not the way I learned it in school, and that's okay. Think about, they have learned the textbook way to do things. You're going to teach them your organization's way to do things, as well as some tips and tricks that you've learned along the way to make their day a little bit easier. But remember, you're always going to use those evidence-based practices that we have in Elsevier skills. That's what you're validating them against. So when you've done your fabulous job of precepting this bright and shiny nurse resident, they will be ready to move on to independence, and they'll be in stage 2 as an advanced beginner. So now they are a graduate nurse, they're at the end of orientation, they've demonstrated acceptable performance, they are safe practitioners, and you're ready to now be a peer. Your role is going to change a little bit. It's not over, but now you're moving to that coworker, peer, support person. You may end up being a long-term mentor. And so you're still going to be available to them because they're still going to have lots of questions. But now you're not married to them anymore. You're not with them the whole shift. You've done your job. So once they've moved from that initial first shock phase, they were all excited, and then they started to adjust. They went through that provisional adjustment. They were in the honeymoon phase where they think everything is great and every day is exciting. And then right as they're getting off orientation, see how that curve starts to dip? And now they've got uncertainty, they're losing their confidence, and they're out on their own. So hopefully this is where you're still reaching out and checking in on them, making sure that they're still okay, that you're there as a resource and a support, and you know that they can continue to do the great job you trained them for. But you see how low that gets. In like month 6, we lose a lot of residents at that point. So we really need to pay attention to them in the continuum. Your role doesn't stop at that 12 or 16 weeks. So I'm going to show you in Elsevier Skills how to look up a skill that you're not familiar with and how to grade a checklist. So you go to Skills, and first we're going to view a skill. We are going to look up chest tubes. And when I look it up, there's lots and lots of options. So we're just going to do a closed drainage system. And then once I pull up the actual skill, you can see I have lots of options here as well. So the quick sheet is a quick, down and dirty information that you need. The extended text has all of that same information, plus now it has the references and more detailed information. It's kind of everything all in one page. There's the supply list. So these are the supplies you would need to care for or insert a drainage tube. A chest tube drainage, assist the physician with that. There's demonstrations, and the video is not going to play on my screen, but on your work computers it will. So there's information about the chest tube drainage system, how it works, insertion, and then the lung sounds that you're going to hear when a patient has a chest tube. So it's really cool to look at this. There's illustrations where these are just pictures. So there's the good old-fashioned 3-bottle system, and then how that equates with what we have now. There is a post-test, and so as you know, some of the skills assigned to all orientees include a test. So it's usually they have to take the test or you're going to validate them. And then here's how you validate them. This is the skills checklist. So this is what you're saying they have met all of this criteria in order to be proficient and safe. You don't have to print this out and turn it in. You can print it out and take it into the room with you if you wish, but it's not necessary. You're actually going to grade them in the computer. And then there's related information. So this is all the other things that might be related to that topic you're looking at. So if we go back to skills and grade a checklist, now we're actually going to grade the skill that we just watched. We've gone in the room, we've done it with the resident, they have shown proficiency, and now we're going to grade them and show the skill that they have. So I'm going to say I want to look at up by the learner. I'm just looking up somebody who happens to be on orientation right now so that you can see their list. And so these are all the things that this orientee has to be validated on by you, the preceptor. So you can see that there's a couple of them checked off by me. These are the ones that we did in nursing orientation. So you would, when you're ready, you would do the drop-down box, and pass means either they have done it proficiently, you've seen them do it, and they're safe, or they never had the opportunity to do it in orientation, because you're not going to see and do everything on this list. But you have talked through it, they know how to verbalize, that they understand, and they know their resources. So you're still going to say pass, and then you're going to add a comment. Fail means they were not safe. Nothing on the orientation skills checklist needs to be left undone. Everything needs to be in the pass category for them to come off orientation. If it is a fail, they are unsafe, that needs to go to the manager and or educator immediately. In progress, we currently don't use in progress because it leaves it hanging out, and nobody's going to go back into the skills list after you, the preceptor, have finished your part to complete these. So in progress, we don't currently use. However, we will start using it in October of 2019 with our nurse residents, where we are going to start doing some of the skills in simulation ahead of time prior to them reaching you on the floor. And at that time, they will, we will check them off in skills lab on some skills totally. We will totally pass them. And then other ones we will put in that in progress category. And that means that we validated them on a mannequin or in a simulated setting, but we still want you as the preceptor to go back in and validate them on a real person. Also contained within this module is the Nurse Residency Handbook. It is provided to all nurse residents when they go through their orientation to residency. I share it with all of the managers, and I want to make sure that you guys as the preceptors also have it. You can print it out from this module if you choose, or you can just refer back to it here in the hub. I do update it with each cohort, but it's minimal changes, mostly date type changes. So the things that you really need to read in that manual is the nurse residency executive summary. So it just gives you an overview of the entire nurse residency program, as well as the goals for the program. Then there's 4 sections of responsibility. What is the manager responsible for? What is the unit educator responsible for? What are you as the preceptor responsible for? And then what is the nurse resident responsible for when they're with you, as well as with their evidence-based practice projects? So I really need you to pay attention to the preceptor responsibilities, especially these sections related to calling in, socializing them to the unit, when can you float, when can they float. So please look over that content so that you're familiar with it. Then there is a section also at the end, it's an appendix called the married state. So the next slide will discuss the married state. All right, so you're going to read an article about the married state model of precepting. And what I really want you to take away from that is a new way of thinking. Most of us were oriented, especially if you were in the medical surgical areas, that you've got total care of one, I've got the rest of the assignment, call me if you need help. We are moving away from that model. Literature has shown us, the evidence has shown us that we really need to be with the nurse resident or married to them for the continuum of their orientation. And what that's going to do is going to allow for critical thinking. So if you're building up the orientee, the old-fashioned model, one patient at a time, often they're not to a full patient assignment till very close to the end. And then we get upset that their time management is not good. Well, they've never managed their time. They've never seen you manage your time. So they need to see that from day one, how you come in and start your day, how you get report, organize and prioritize your day, and how those priorities change throughout the shift based on what's thrown at you. Admissions, discharge, patients crashing, visitors coming in, the physicians rounding. And how do you adjust your day to keep up with everything? And so they'll build confidence as you move them forward with skills and some of the care. So they're going to do a percentage of the total care versus one patient, then two patients, then three patients. You're never going to put them in independent practice, which means you're always going to be there. Your roles are going to flip by the end. At the very beginning, you are the doer and they are the watcher. They are your shadow. Then you're going to eclipse each other so that by the end, they are the doer and you are the observer. You're validating and observing everything that they do. So you're socializing them to the unit, to your coworkers, to the interprofessional team. And so that's going to alleviate their fear and increase their confidence as you manage them up with your peers and with the patients and the team. One of the tools that we provide you to help guide you through that married state version of precepting is called the milestone pathway. And so it's going to help set the pace of your orientation. How do you progress somebody through orientation and build up those skills? Remember, for the entire population of patients, how do you set goals weekly? We've actually set them for you, which is really nice. It guides the orientation in a timely manner so that you're getting through all the steps that you need to get them independent. It is a tool for you and your nurse resident to use. There are two different versions. The first version is found in the appendices of the handbook. It's a blue and white multi-page Excel document. And so there's a column for acute care and a column for critical care. And then there's another version that one of our other unit educators created for her preceptors that is more of a stepwise visual that shows you week by week how you're going to add those skills. Because remember, you're not going to send them to do things like transport a patient without you. You're always going to be there. You're not going to send them to do a skill, even if you've seen them do that skill 5 times. They need you there. They need your feedback. They need your reassurance. And remember, you are validating that they are safe continually as the scenarios change, as your patient's acuity changes. And so you've got to be there to be able to validate those and visualize their thought processes and them to be able to talk through the different decisions that they make. Okay, to wrap up, I want to say how thankful I am that you guys agreed to be preceptors for the nurse residents. I can tell you it's a rewarding experience to welcome them, and I hope you catch on to their enthusiasm and their excitement about everything new and bring them into the fold and create a wonderful coworker for yourself. This last activity is just a little reflection for you, so you get in the right mindset of bringing on this new resident. Think about when you started as a new graduate or an RN1, did you participate in a nurse residency program or did you only have a unit orientation? Was it a push you out of the nest kind of experience, or did they welcome you with open arms and bring you in and really support you through the process? Then think about your first preceptor, and you can see the characteristics there. You can pick one or more of those of how your preceptor was, and then what kind of a preceptor do you want to be? And then the last thing to reflect on is how would you rate your competency at the end of your orientation when you were on that first shift by yourself? How competent were you? Were you a novice, a beginner, an advanced beginner? Did you feel totally competent and ready to take on the world? Or did you feel clueless and scared? So think about where they're coming from and where you want them to be. They desperately want to be you, but it's going to take time and it's going to take your effort. Thank you so much.